Hey guys, we're going to go through the McKenzie Flexion sequence. Remember, this is for patients who have stenosis. Basically, we're trying to open up those facet joints. We're also trying to stretch out soft tissue. So somebody who has been in pain for a long time, maybe they don't have the segmental mobility to be able to flex at each and every segment of their spine. So we need to stretch out the lumbar extensors. We need to maybe stretch out the intervertebral ligaments. But once we get that ability to move, we want to open up those facets. The idea is to take pressure off of the nerve roots and the peripheral nerves that might be compressed because of stenosis, because of decreased area or decreased space. Because of changes that usually happen with aging, like decreased disc height or bone spur development, things like that. Okay, so patient, if you will bend both your knees, just like that. Okay, we're going to start with a posterior pelvic tilt. Okay, so I'm going to slide my hand right underneath your back. Is that okay? Okay, I'm going to put my back hand right here. Just lay on me. Okay, and what I want you to do is I want you to tighten up your tummy muscles and press into my hand as hard as you can. No, don't arch. Press down, like my hand is a bug that you're trying to squish. Okay, and you feel how your tummy is tight when you do that? Okay, good. That's a posterior pelvic tilt. Okay, I want you to do that again. Press down as hard as you can on my hand. Squish it. Squish it. Okay, and hold, and I want you to count to 30 out loud.
1.
Squish my hand.
1.
There you go.
2,
Good.
3, 4, 5.
You let go. There you go.
6, 7, 8, 9, 10, 11, 12, 13.
Okay, and she let go again. So with her, we might have to start off at 5 or 10 seconds at a time. She's laughing a lot because she thinks it's funny. But I have to start with what she can do. Okay. Once she could do a solid 30 seconds, okay, that's when we're going to start to see some changes. Okay, so I would have known what her pain was when she laid down, and then I'm going to ask her if she feels any change during the posterior pelvic tilt. Okay, she might say she feels some stretching or some tension in her back. She might say that her radicular pain is less or that the pain in her back is less, but that's where we start. Now, when she can hold the posterior pelvic tilt without holding her breath for a good 30 seconds, and usually we'll do it 3 or 5 sets, and she's not feeling tension anymore, then we can go up to the next. Okay, and the next thing is grab one knee and pull it up to your chest. Okay, now you can see that this is resulting in a bigger tilt. Okay, more opening, more flexion in the lower lumbar area. Okay, if she was having trouble holding this, say she had a big belly or short arms, okay, you can absolutely use a towel or a sheet or a belt or a dog leash or anything you got. Okay, and I could certainly have her pull like that. Okay, again, if somebody was really weak in their arms or weak in their legs, let me have this. We can use the Swiss ball. I'm gonna cut in front of you here.
It's all right.
Okay. And put your leg on the ball, and let's just roll this in. And I could even help. You're doing fine. Okay. But this kind of helps hold the weight of the leg for her. Okay. Again, this usually feels really good. She says yes. So there's no harm in having somebody do this for 5 minutes. Okay. I don't want them to stiffen up. I don't want them to stay there for half an hour, because when they put their legs down, they're going to be stiff and kind of stuck. But we can absolutely have somebody do this for as long as it feels good. Okay. Once they have full range of motion with one leg, I go to the other leg. Okay. And make sure she's got full range of motion there. And again, once she can do this and she's got full motion, or for her what normal motion is, and she says, hey, it feels good, and I feel like I'm really stretching out everything, then we can go to double knee, and that's the next progression. Okay, so we're gonna put both feet up here. Let me get this in the middle. Okay, now she could do this, just hug both your knees to your chest for me. She can do it like that. Or she can fold into like a little egg. I can't do it that way. Okay, so again, she could use a belt or a sheet or a towel to help her, or she could certainly use this. And of course, I could help her. I could fold the ball in on her to get full range of motion. Okay, these first few, the posterior pelvic tilt, single knee to chest, double knee to chest, that's all about segmental mobility and stretching soft tissue and opening those facets and getting pressure off the nerves. Okay, once we have gone through those, you're going to take your legs down. Now we have to strengthen, go ahead and take your leg down. We have to strengthen the abdominals. Okay, we're going to do some sit-ups, some crunches. I know, I'm sorry, I didn't tell you had to do that, did I?
I want you.
You're fine. You don't have to sit all the way up, you're just going to do a crunch. Okay, so let me take the pillow away. You're fine. You can do crunches.
I know, but I like the pillow.
Okay. So the first, we're going to do a straight up crunch. And the easiest way to do it is keep your hands on the table. And you're just going to try to lift up enough to get your shoulder blades up off the table. Good. Okay. Do that 10 times for me. You can do it. 1. Blow out as you come up.
Okay.
Very nice. You don't even come up that high.
Oh.
Okay, right to there. That's all you need.
Okay.
You've
That's
done.
like number 4.
Okay, so she would do 10 of those. Once she can show me she can do 10 really well, I go, that looked a little bit easy. So the progression here is put your hands across your chest. Now do the crunch that way, just like that. Good.
That's harder.
I know. Keep enough space between your chin and your chest that you could fit an orange. Good. So it's almost like your head is going straight up towards the ceiling. Nice. Good. Good. Okay. No, that's fine. Okay. Once she could do 10 of those, then I might go, ooh, this is easy. And we do hands behind the head. Don't put your hands like this, because what you'll do is you'll pull with your arms. So you can either put your hands here, or you can put your hands like this, but don't bring the fingers together. Okay? Good. Good. Nice. Breathe out as you come up. Good. And she's getting tired. I know. Okay, so that is the full, oh no it's not, we hadn't do rotation. We need to do rotational next. Once she can activate rectus abdominis and bilateral obliques, then we're going to ask her to activate rectus plus one side obliques, which is harder. So what I'm going to ask you to do is you're going to come up with a rotation. You're going to aim this shoulder towards this knee. Like that. Nice. Okay, or you can put your arm and you can slide it right to the outside of your knee. Good. Good. So one of the biggest mistakes people do is they will bring their elbow towards their knee, and what they're doing is they're using momentum. So you want to make sure either that they're just barely coming to the outside of this knee, or if they have their hands up here, that they're aiming their shoulder towards their knee, not their elbow. Okay, shoulder, there you go, nice. Okay, so that is the full Williams flexion progression. Okay, again, in your book, each picture is a progression. Modifications would be using a towel, or using the Swiss ball, or using assistance, just to make things a little bit easier on the patient. Progressions are also position of the arms during the crunches, okay, because each one of those is actually harder. You're increasing the lever arm and the weight at the end of the lever arm. Okay, that's it for Williams flexion.